Hello everyone, this is Dr. Anna Angelica Makalalad Josue, and today we are going to discuss medicine during the Hippocratic times. So we first begin with Asclepius, or in other variation he's also called Asclepius. According to the Greek legend, Asclepius was the son of the Greek god Apollo and Coronis. Coronis was a daughter of a Greek king. However, Coronis became unfaithful at some point, and because of that, Apollo was very angry, and in his anger, he decided to kill um, Coronis. However, during that time, Coronis was already pregnant, and because the Apollo felt regretful because of that, so he decided to remove him from the womb of Coronis, no, while she was burning on the funeral pyre. So therefore, that's where the name Asclepius came from, which means to cut open. So Asclepius was then raised by the centaur Chiron. So this is Chiron, and who educated him in the art of medicine. So according to the Greek legend, Asclepius was said to have been aided in his studying by a snake. And in gratitude for an act of kindness, a snake cleaned the ears of Asclepius, providing him with knowledge that had been previously hidden from man. So that's where the rod or staff of Asclepius originated. That's why the traditional symbol of medicine has snakes on it, because it originated from this Greek legend. No? And from then on, Asclepius was known as the god of healing. So a variation of this is the caduceus. No? They look similar. So Asclepius became so powerful in his ability to heal the sick that it was noted that he was also able to raise the dead. And because of that, see Hades, remember Hades, he was the god of the underworld. He became worried that there will be no more spirits that would descend into the underworld. So Hades complained to Zeus, and Zeus responded by killing Asclepius with a thunderbolt. No? And after his death, Asclepius remained highly venerated by his followers. And they built many healing temples called Asclepeia. So they form a cult, the cult of Asclepius. And the Asclepeion that's the singular form of it. Asclepeion, or healing temples, were run by priests. These priests were followers of Asclepius, and their emphasis in their healing was more of spiritual. So the patients, or those who seek healing in these temples would be um, cleaned. They would be healed through spiritual healing, and it was believed that when they go to sleep, Asclepius will appear in their dream, no? And in their dream, Asclepius would tell them on how to heal their sicknesses, or give them advice on how their illnesses should be treated. So it was believed that the Greek god Asclepius had a daughter named Hygeia, and she was named as the goddess of health, cleanliness, and sanitation. And she aided us, or the Greek people during that time, in the prevention of sickness and the continuation of good health. And it was believed that, so this is where the name hygiene came from the god of health, Hygeia. So the goddess of health, Hygeia, the goddess of healing, the god of healing is Asclepius. So that's the Greek legend behind it. But Greek mythology. But in the real world, there was a man named Hippocrates. And Hippocrates is largely attributed as the father of medicine. So Hippocrates lived in the island of Kos. Kos is an island in Greece, and he was the one who started the concept of physis or physical and of disease as a kind of physical dysfunction or disorder. In the past, no, illnesses were thought to be punishment for being bad or doing some crimes, but um, Hippocrates believed that disease was something physical, not a dysfunction or disorder. And he also conceptualized that the person that would be most appropriate to deal with illnesses was not a priest, but a knowledgeable layman. And Iatros, or the physician, was born. So Iatros is the Greek name for physician. And a layman not only acting with knowledge as a healer, but also with God's help. No? So it's not purely physical, but a combination of, it's not purely spiritual, no, coming from priests, but healing should be both physical and spiritual. So Hippocrates emphasized the importance of observation in diagnosis and prognosis. No? So much similar to what to do today. We look at the clinical symptomatology of the patient. No? And he believed that the observant physician could draw on both senses, no? Physical senses, your eyes, your ears, your sense of smell, and then logic in interpreting clinical findings for the benefit of the patient. And from theocratic medicine meaning healing from God, no, or spiritual healing, to rational medicine. No? He was the one, the current medical concepts today that is attributed to Hippocrates includes erythema, exanthema, lichen, psoriasis, edema, leukoderma, pachyderma, alopecia, apoplexia, melancholia. So many um, medical terminologies that we use today actually came from the time of Hippocrates. He believed during that time that there were four humors that had to be balanced. No? The four humors were the yellow bile, the black bile, the phlegm, and the blood. And he believed that they should all be balanced. If there is any imbalance, then there would be pathology. No? So if there's balance, the body would be healthy. So during that time, they were able to make a collection of around 70 early medical works from ancient Greece associated with Hippocrates and his teachings. And this was named as the Hippocratic Corpus. This became sort of their textbook during the world, no, for medicine. So for a long time, from the antique world up to the Middle Ages and even later, this was their main source of information, and it contained 42 case histories, and it was enriched throughout the years and completed by Hippocrates' students and scholars. Description of the Asclepion, you would be able to deduce that they place a lot of emphasis on relaxation, mental healing, um, mental spiritual healing as part of the whole physical process, no, from diet to exercise to physical rehabilitation to rest and relaxation. And that's just very similar to what we actually advise patients today, diba? So they emphasize the holistic concept for diagnosing and treating human disease. No? They based their treatment based on the current scientific knowledge of that time, with emotional compassion and prayer, and with physical exercise and nutrition as well. No? And I think over the years, when we've shifted from preventive to 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 therapeutic medicine, no, somehow these concepts of healing took took a sidestep. No? So we focus more on giving prescription, on giving on doing procedures, no, laboratory tests, when in fact this is part and parcel of healing as well, no? Nutrition, diet, and sometimes you just pay lip service, or usually at the end of the consultation, we'll just briefly tell them, oh, you should go on a diet, you should eat healthy food, you should exercise. But we never really emphasize too much on that. We more or less give emphasis on giving drugs, procedures, but they should be balanced as well, not just um, give prescription left and right and then forget about this part. Because for me, no, when in my practice, um, I try to do a 360 degrees. No, I give medicine, I give laboratory requests, interpret the test for them, but I also give emphasis on nutrition and exercise, because for me, food, no, and exercise and relaxation is medicine as well, no, and it actually has a physiologic basis for that. When you're stressed, no, your hypothalamic pituitary adrenal axis goes in an overdrive. There's an increase in stress hormone levels. We think it's just in our head, but there's actually a physiologic basis for this. No? So if we just also incorporate this more on our daily routine when we go into the clinics, I think it would really help a lot, and it doesn't really cost that much for our patients. So the oath, so during this time they were able to formulate the famous Hippocratic Oath, or the oath, no? And these were a series of ethical rules that that follow the medical ethical rules, no other. Act only for the good, upon your own critical knowledge and own responsibility. Give neither drug nor advice for death. Keep own pure life, pure and sane. So let's go back, no? So as physicians, we're expected to follow the medical rules like no other, no? Ethical, no? I think some doctors have forgotten about this already, the ethical part of being a physician. No? That's why when I hear physicians um, being involved in illegal activity or unethical practice, no, I get sad, because that's a very first part of our Hippocratic Oath, to act ethically. No, so for example, doctors who dispense drugs, no, in their clinics, that's not allowed. Pharmacies are only the ones allowed to to dispense drug. That's not ethical. Also, what are some of the popular unethical things that some doctors do? Say overinflating the diagnosis and the PhilHealth so that they can get more disbursements. That's unethical, no? So I hope that the reason why we're teaching you this also is that as early as a medical student, you will be able to incorporate being ethical at the beginning. So later on, even if you encounter some consultants that practice some um, unethical ways, no, you will be able to detect one from the other, and hopefully not assimilate those unethical ways as well. No? So, second, we should act only for the good, upon own critical knowledge and our own responsibility. No? So, only for the good and not to inflict harm, diba? This also forms the basis of our the principle of non-maleficence. First, do no harm, and then give neither drug nor advice for death. So I think this pertains to euthanasia. And keep own life pure and sane. As physicians, we are always regarded in the with highest moral respect. So in that regard, we should keep our own life, pure and saintly, because people look up to us as physicians, and also keep medical profession pure and saint. All seen or heard of people's life will remain unspoken. So this pertains to doctor-patient confidentiality. So be careful about that, especially now that teleconsultation has become more 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 in use, in the clinics because of the pandemic. Now we might be able to share some of our patients' information to other people or post them on Facebook, on social media. Please be careful about that. No? So respect all this as it is written and swore for maintaining life and medical profession honored by all mankind for all times to come. So I hope you remember all this series of ethical rules from the Hippocratic Oath, and this will be part of your exam as well. Okay? So let's move forward. What happened after Hippocrates? No, after Hippocrates, there were some philosophers and scholars that followed the Hippocratic medicine, such as Herophilus, Erasistratus, who were attributed to start the study of anatomy and physiology. Dioscorides, the study of pharmacology, herbal therapeutics. Galenos, also with anatomy, internal medicine, pharmacopy, and iatrosophy. So Herophilus and Erasistratus formed foundations for the study of anatomy and physiology. So Herophilus was the one who first documented intelligence, that intelligence was from the brain and connected the nervous system to motion and sensation. And he was also the one who discovered arteries and veins. No? So now parang we don't even think about this, but there were actually people who discovered this during their times. Erasistratus was the one who connected the increased complexity of the surface of the human brain compared to other animals to other animals. So Galen of Pergamon is one of the next big names after Hippocrates. No? He was a Greek physician who practiced in the Roman Empire. He was the most accomplished of all medical researchers in medical antiquity. He built on the so he was a follower of Hippocrates, and he built on the Hippocratic view of disease, and he expanded this by incorporating new knowledge during that time, of course, knowledge of anatomy and pathology. So he was the one who promoted the Hippocratic therapeutics in the Roman Empire. During the time, the Roman Empire had a big clout beyond Greece, no? So, and that spread the works of Hippocrates and the other followers of Hippocrates, no? So Galen promoted venesection or bloodletting, and he also promoted logical approach to the diagnosis and prognosis disseminated through his extensive writings. So the best physician is also a philosopher. Quod optimus medicus sit quoque philosophus. So that's one of the famous quotations from Galen, the philosopher and physician. So he believed in the power of experiment and observation, and he was believed to be the first physician, physiologist to ever announce that blood moves. So now we take this for granted, but during the time it was actually something new for them. No, he dissected on pigs and apes because he was also the physician of the Roman emperor during the time. So he had some power and he was allowed to do these experiments on these animals. And he formed theories that dominated the European medicine for well over a millennium. And I think instrumental to this also was that he translated the scripts of Hippocrates from Greek into Latin, and then eventually this were translated to Arabic. So this helped spread the concept of Hippocrates in treating disease with rational medicine. So a sampling of Galenism's successes, he taught everyone that diagnosis of disease can be made also by careful attention to the patient's pulse, no? Parang si Zhang Yu. Diagnosis of disease by careful attention to the patient's urine, removal of cataracts from patients' eyes. I just can't imagine during that time how they did that, no, with lack of sterility. Diagnosis of physical symptoms caused by psychological disturbances. So I think that would mean like septic encephalopathy or hepatic encephalopathy, metabolic encephalopathy. Proof that urine forms in kidneys and not in the bladder. He also discovered that arteries carry liquid blood rather than, as previously thought, gaseous air. So he also had identification of 7 of the 12 cranial nerves, such as the optic nerve and acoustic nerve. He also identified two types of blood, the bright red and the dark red. So that probably pertains to arterial blood and venous blood. And he also discovered that the heart has 4 valves and they allow blood to flow in only one direction. So these are pretty big discoveries at that time. Afterwards, in the time of the Pagan Graeco-Roman period, medicine spread throughout beyond Greece and the area of Rome, no? And what happened during the time, during the appearance of Christianity, there was the revival of the old idea that disease may be a stigma for sins to be cleared by God's blessing. Remember that, leprosy, just like in this picture, was thought of as a punishment from God, no? During this time, they were trying to debate faith versus knowledge. But Clement of Alexandria, I think he was a pope, he said that the correct teaching of God's lesson may be reached through faith based on knowledge, so that God as such is invisible and unspeakable. So it's a balance of both having faith and knowledge at the same time. So the fathers of the early Christian church, such as Gregory of Nyssa, Basilius of Caesarea, and Augustinus in the West, favored the concept of traditional medical knowledge and knowledge in general in the name of God, and that all wisdom derives from God. Omni sapientia ad Deo. And during that time, only the rich people or the more influential people were allowed to have knowledge about medicine, along with grammar, rhetoric, dialectic, mathematics, geometry, astronomy, music, and medicine. And this became the standard canon of the Christian elite. So during that time, the medical profession remained largely in the hands of well-educated Christians for long, despite its pagan, non-Christian origin from the Greeks. So because of the spread of the information throughout the entire European continent, and the transfer of medical knowledge from the Greek to Arabic, this became an important step for the development of European medicine. This time, the transfer of medical knowledge now spread to other countries like Cyprus, Greece, Lebanon, Syria, Palestine, Israel, Turkey, Egypt, and Jordan. And that's largely because of the translation. And it's largely the Arabs are now, the Arabs have been parang attributed as the one who had really great contribution during the Middle Ages to preserving science for the following centuries. And that's how the Hippocratic concepts of using knowledge to treat, using knowledge and physical diagnosis to treat disease spread throughout Eastern Mediterranean, Middle East, and Central. So I think the lasting legacy of Hippocrates was really this, no? To cure sometimes, to relieve often, but always, but to comfort always. So sometimes we forget, no? When the case becomes so complex, we focus on trying to cure patients. It's a bonus if we're able to cure them, but I think the priority is to give comfort always, to relieve often, and sometimes to cure patients. So in the complexity of things, do not in your quest to cure the patient's disease, no? Especially if it's a multidisciplinary problem, always put the patient at the center of the case and always think how you can comfort the patient or even the relatives to relieve their pain and their suffering, no? The priority is not always cure, especially with, let's say, for example, cancer, especially if it's terminal cancer. Some doctors forget um, the the pain and suffering that patients have to go through by going through all the cures and the procedures and the treatments that we want to the patient to undergo. So let's not forget about this lesson from Hippocrates: to cure sometimes, to relieve often, to comfort always. Been a reboot of this, no? Another important quotation from Hippocrates is that life is short, the art long, opportunity fleeting, experiment perilous, and judgment difficult. So these are the things that as physicians we need to remember, no? That life is short for patients. The art is long, the study of medicine is long and arduous, no? Learning the art of medicine doesn't end when you graduate, when you take the boards. But even now, long time consultants still continue to learn. I hope you're not the kind of doctor who stops learning after graduation, that you continue to broaden your knowledge. And I've seen a lot of doctors like that, no? What they know from long time ago was the thing that they only know until like 10 years after they graduate medicine. Only they prescribe only the very, very old prescriptions, no? Or prescribe very old treatments, and they forgot about to update themselves, no? Medicine is a lifelong learning. And opportunity fleeting. Sometimes you don't get the second opportunity anymore when we treat patients. Sometimes you will experiment on patients, and this could be dangerous. Not really dangerous, but you will have to take risks. No, you have to balance now the risks and benefits for your patient, and there will be times that you will have difficult medical judgment. So these are some of the things that we this for. So now there's now a reboot of the original quotation of Hippocrates, and as a modern physician, let's cure sometimes with complete remission or excision, improve patient outcomes as often as possible, educate the patient and her family, and reassure always. No? So let's not forget this. So again, so cure sometimes with complete remission excision, improve patient outcomes as often as possible, educate the patient and her family, and reassure always. Okay? Sometimes reassurance wins you half the way. No? Sometimes the reassurance of patients calms them, relaxes them, and helps alleviate their pain and suffering as well. And you're halfway there, even if you haven't given the first medicine yet. Okay? As a reminder, the Hippocratic Oath is a must know. So I expect you to be able to be very, very familiar with the Hippocratic Oath. So here, okay, I'll just, here's the old version.